so you first do initial on-the-field evaluation. So you survey the scene, then you go into your primary assessment, and you do ABCs, and then you check level of consciousness. After that, you go into history. So you ask if there's a witness, anybody saw what happened, if they have paralysis, paresthesia. Ask if they've had any headaches, nausea, or dizziness, type of pain, mechanism of injury, if they've had any previous injuries, anything that increases or decreases the pain, and then interthecal pressure, so when they cough, sneeze, or laugh, if any of that causes more pain. Then you go into observation, so you look for any obvious deformity, look for signs of trauma, swelling, or discoloration. Then you're going to look at postural alignment, you're going to look at gait, you're going to look at splinting of the neck, see if they have any of that. Their willingness to move, and then you're going to look at facial expression and see if there's been any muscle atrophy. So I'm actually going to have you turn around, Clayton. Okay. So I'm going to do palpation. A little more. Yeah, there you go. All right. So the occipital protuberance, right in here. Then you have the greater occipital nerve, which is right in here, and then it goes up to the head, and there's two of them on the left, one on the right. Then you do the superior nuchal line, which goes from the occipital protuberance. You follow the ridge across to the ear. Then here you also have the mastoid process right in here. All right, then you have cervical spine, or cervical vertebrae down in here. You can find down in here. And you can feel their spinous processes as you go down. And then right above C7 at C6 is the cricoid, or the cricoid tubercle, C6, then you palpate the traps, and then go to the side. Push against my hand, or don't, yeah. And you have the, no, don't let me push against, or don't let me push you, buddy. There we go. You have the sternocleidomastoid right in here. Ready? Go this way. Lift your head up. Then you have, so the trachea, and then along the trachea, yep, lift your head up. Yep, there we go. You have the cricoid cartilage and the first cricoid ring right in here. And then you have right here the thyroid cartilage, and deep to that is the thyroid gland. And then right up in here, you have the good? You have the, head up a little more. You have the hyoid bone. Then you palpate along here for the lymph nodes. And then along, nope. Relax, I got you. Right around in here you have the parotid gland. And then here you have the supraclavicular fossa. So, actually, like that. Yeah, and then you can kind of see it. And then right in here, you can kind of feel the first rib, and then the second and third ribs deep to, or below the clavicle. And you also take a carotid pulse. All right. Then we're going to go into range of motion. So I'm going to have you do active range of motion. So neck flexion, neck extension, yep, and then lateral rotation like this. And the other side, or sorry, like this. Yep, and then rotation like this. Yeah. Now we're going to do each of those resistive range of motion. So I'm going to have you go into flexion, and then don't let me move you out of it. Okay. Good job. Now go back into extension. Don't let me move you out of that one. Okay. Decide. Yep. Don't let me move you out of that. Good job. Now go rotation. Like, yeah. Now don't let me move you out. Good job. Then, oh, we're going to go into the neurological exam. So C1 and C2 is neck flexion. So do neck flexion again. Yep. And then, you can come back up. Then C3 is shoulder elevation. So go up. Yep. C4 is shoulder abduction. We got like this. Yep. And then sensory is the lateral part of the arm. And then C5 is elbow flexion and wrist extensions. Yep. And then sensory for this one is C2. So we're going to start the neurological exam all over again. So C1 and C2 is neck flexion. Yep. Then C3 is neck rotation, or neck flexion, sorry. Go like this. Yes. Then C4 is shoulder. Yep. And then right there, shoulder elevation. And then sensory is, you relax, is right supraclavicular, so right here. C5 is shoulder abduction, something like that. And then sensory is right along here. And then reflex, if you were to do a reflex, you do it right here on the biceps. C6 is elbow flexion and then wrist extension. And sensory here is lateral arm, and the pinky and lateral portion, and the thumb and the pointer finger. And then reflex is on the brachioradialis. C6 is, C7, that was C6. C7 is shoulder or elbow extension, wrist flexion, and also finger extension. You don't have to do all of them together, but it does all those motions. And then sensory here is middle finger, and the reflex is the triceps. C8 is finger extension, thumb or finger flexion, thumb extension, and then ulnar deviation. And then sensory for this is your ring and your pinky finger, and then also the medial portion of your arm. And then T1 is finger abduction and adduction, and the sensory portion is the medial part of your forearm. All right, now we get into special test. So for this one, can you lay down on the ground now? Have your head facing towards me, please. Thank you. So this is the vertebral artery test. Ideally, you'd want to be doing this off of a table, so then you give them cervical traction. You can even tilt their head side to side. Then you have them look back at you. Yep, and then start counting down from 20.
20, 19, 18, 17.
Good job. And then, so they go all the way back down to 20, or down to 1. And if a positive test would be they can't complete it, either because they pass out or like they just run out of air and they can't do it, and that's positive for a C-spine injury or like a blocked vertebral artery. Okay, you can get back on the table. Next one is the pulse pincher test. And this one, you have, go sideways, okay? So you have a hand right here on their forehead, and a thumb right at the axis and the atlas. Sit straight up, bud. Yep. And then flex, yep, like this, and then don't let me push you back, okay? You go like that. And a positive test would be the patient would feel a pop or a click in the roof of their mouth, or you as the examiner would feel a pop or pushback at the axis or atlas. That's positive for a dislocated or subluxed atlas or axis, and you'd have to lay them down and spine board them. Then you go into Spalding or Spurting's test, cervical compression test. So sit straight up, and I'm gonna compress you down. And if they have recreation of pain, and I'm gonna start tingling down the arms, then that's positive for a nerve root injury. And then this is cervical distraction test. So you'd lift up on the spine by doing this. And if their symptoms go away, then that helps identify a positive for cervical nerve root. All right, then we're gonna go into Valsalva test. So this is one where I'm going to have you bear down, then you're going to the bathroom. And if you have pain with that, then that is normally lumbar pain or lumbar, lumbar injury. And then you have Nafsinger. This is where you cut off the jugular vein for 30 seconds, and then you make them cough, or have a cough. And if they have pain with that, then that's a cervical nerve root injury. The next one is shoulder depression test. So I'm going to have you tilt your head to the left side, yep. Like that. And then press down on their shoulder like this. You're creating a stretch in the brachial plexus. If they have pain with that right in here or down the arm, then that's positive for a brachial plexus injury. Shoulder abduction test, or the sitting monkey test. Put your hand on your head. Keep your head straight. Yep. And if the symptoms relieve themselves when they do that, or even if they can't, if they tilt their head to the side when they do this, then that is positive also for brachial plexus. The next one is Tinel sign for the brachial plexus. So right here, you tap on the Erb's point. And if they have pain radiating down their arm, then that's positive for a brachial plexus injury. Now the last one is I want you to swallow. And then you can do this with water or even like a little bit of food. If they have trouble, if they have gagging, or if they can't, if they just have trouble swallowing, then that's positive for an anterior cervical spine blockage. And if that happens, then you send them to a neurologist. And those are the special, and then refer. And then with most of these, you can compare bilaterally, or like for the nerve root injuries, if it happens on one side, they're a nerve root injury. But if they have pain with both sides, that's normally indicative of a disc injury.